Today's episode is brought to you by DAX Copilot from Microsoft. To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, visit aka.ms/knock-knock-high. That's aka.ms/knock-knock-high.
Knock, knock. Hi.
Hello, welcome to Knock Knock Hi with the Glockenfleckens. I am Will Flannery, also known as Dr. Glockenflecken.
I am Kristen Flannery, also known as Lady Glockenflecken.
How's your puzzle coming along?
It's coming. I'd say I'm about 75% done.
Kristen got
750 pieces or so.
from her daughter. She got
From our daughter.
she received a 1,000 piece puzzle for Christmas.
Yes.
And you've been working on it for a while.
Well, I had to stop. It's been out for a while, but I haven't been working on it for a bit now.
So right now, try to explain to me why you like doing this. Because I can't last
I know.
30 seconds doing a puzzle. It is the most boring thing I can.
And that is how I
possibly think
feel about board games, but you like board games.
But it's not like you're playing a game. Like puzzling.
Yes, so
what are you doing? You're just
well,
there's no skill, right? Is there skill involved in puzzling?
Sure there's skill.
What? How? You're just you look at each individual piece and try to see if it fits. Am I going to piss off the puzzle community?
You are, because there's all sorts of stuff to it. There's, discernment of like color, shape. You might be picking up a piece and trying it all over the place, but that's a very amateur move. I can often just look at the pieces and know where one goes.
You do the outside first.
I like to do that.
You got to get the border done.
Uh-huh.
But then then the fun's over.
What?
Then you're done.
That's just the start.
No, the rest of it is the inside, and it just sucks because it's hard and there's 980 pieces.
Your border's only 20 pieces?
It's probably something like that. I don't know.
Didn't you minor in math?
So
I like that it's a satisfying thing to solve a puzzle, right? To solve, whether that's an actual like a jigsaw puzzle or it's like a thinking puzzle or whatever. It's a satisfying thing to solve, but it's also a very meditative process. Like as I'm putting it together, it's like the
brain?
perfect. Well, that's the thing. Usually there's so much stuff happening in my brain. And when I do a puzzle, it's like all that just goes shh. And I can it's like it takes the exact right amount of mental energy and attention that like I am interested enough to pay attention to it. And then it's just like I'm just focusing on that, and I can talk, I can do other things, I can think about other things as I'm doing the puzzle, but it's like it uses a part of my brain. It keeps it busy and out of the way. Like when you have driving. A toddler that
driving.
It's kind of like driving, I guess. Yeah, where you're except driving is more automatic than puzzling is for me, right? Like you don't have to think so much about driving.
Puzzling
usually.
Will take up more of your brain. You just want an activity that's taking up as much of your brain as possible to leave less brain for your horrifying anxiety.
Pretty much.
Okay.
It keeps my brain. Okay.
This has helped me understand you better.
It's probably an ADHD thing also, right? Like it's stimulating enough to help me like be able to focus on something else and not on a bunch of like wandering thoughts. And because I also have anxiety, a lot of those wandering thoughts tend to be not so pleasant.
You know who probably would have been a world-class puzzler if she tried?
Who?
Our next guest.
Oh,
Dr.
probably.
Hayley Wickenheiser.
Yes.
So if you have never heard of Hayley Wickenheiser, like she's incredible. This is like she's a 5-time Canadian Olympic medal champion. What do you call them?
Medalist.
Medalist, yes.
She's a medal winner.
She's a medal. Yeah. One of the best female hockey players in the world. 7 world championships, 6 Olympic appearances for Canada, 5 Olympic medals. Just a titan of hockey. And currently, she is the assistant GM of player development for the Toronto Maple Leafs.
Yes.
All right. As if that's not enough.
Mm-hmm.
Also, she's a physician.
She sure is.
Working in emergency medicine out there in Toronto. And so like she goes and does like hockey stuff during the day and then goes and like works shifts in the evenings.
Yeah. I don't know how she does all of this.
It's incredible. And she just definitely, uses a lot of the things that she's learned as a high level athlete.
Yeah.
Because as we've learned from talking to some of our other guests, there's a lot of skills that overlap between like, becoming a physician, a practicing physician, and the dedication it takes to excel in a sport. So, there's definitely overlapping skills there.
Sure.
Oh, by the way, she's also an Olympic. She was in the Olympics
for softball.
For softball.
Yeah.
For
one sport's not enough.
So just a
phenom of a
fascinating person.
Yeah.
And she has just innumerable accolades over the years. And now she's focusing a lot of her attention on medicine, which those of us in medicine, we really appreciate that. So should we get to it?
Let's go.
All right. Here she is, Dr. Hayley Wickenheiser. Hey, Kristen.
Yeah.
I've got some friends I'd like you to meet.
I see that. You seem a little too friendly with them, I have to say.
Aren't they cute?
Sure.
With the little beady eyes.
Uh-huh.
And their little hands. Are they hands? The claws?
I don't know.
Appendages.
Okay.
How about that?
Yeah, it works.
But anyway, they'd like to say hi.
Okay.
They'd like to say hi.
Okay. Wonderful.
Look, the one's sticking around.
It sure is.
All right.
Right on my mic.
These little guys are Demodex,
and
they live on your eyelashes.
Yeah.
And they can cause flaky, red, irritated eyelids.
See, that's not cool.
You just
that's
kind of want to like
foul.
rub them.
Mm-hmm. You're not welcome here if you're going to do that.
And it's caused sometimes by these little guys.
Yep, that's rude.
Demodex blepharitis. But you shouldn't get grossed out by this.
Okay.
All right, you got to get checked out.
Yes, get checked out.
To find out more, go to eyelidcheck.com. Again, that's EYELID check.com for more information about these little guys and Demodex blepharitis. All right, we are here with Dr. Hayley Wickenheiser. Hayley, thank you so much for joining us.
Well, thanks for having me, guys.
I have a very important question to start with.
Okay.
What is more stressful? Sudden death hockey or doing an eye exam in the emergency department?
Oh.
Ooh, that's a great question. I really suck at eyes. So depends if it's, acute ankle closure or what it is. But I would say that nothing probably will be as stressful as sudden death hockey was for me. People ask me that all the time, medicine hockey. And it's just hard to explain why, but there's something about, playing for your country and winner take all that. Medicine has a different kind of stress, but for me personally, that pressure it'll always be the biggest.
That's also what makes, I think, hockey one of the most exciting sports to see in person. Because I remember we used to have because I grew up in Houston. We had, I don't even know if they still have this. It was the IHL. It was like the kind of like a minor league division of hockey. We had the Houston Aeros.
Yes,
which are no longer around. But we got season tickets one year. So we went that was the first time I'd ever seen hockey in person. And it was so much fun just being right there by the boards. And then it was that sudden death overtime hockey. Like there's nothing as exciting as that, I think, in all of professional sports, in my personal opinion.
I agree.
Yeah.
I mean, 10 bodies crashing around, and it's fast and furious, and it is very exciting, I think, for people.
So I want to start with, you've had just this illustrious career in professional hockey and playing for your country. But let's start when you were a kid. So you grew up, was it Saskatchewan that you
That's good. Yeah,
grew up? Is that
Shaunavon,
right?
Saskatchewan. Yeah, very small town.
What was it? When did you know you were going to be good at this?
Oh, yeah.
I suppose I started when I was 5. In Saskatchewan, it's very cold, not much to do in the small town. So very classic Canadian upbringing, where my dad built a rink in the backyard for myself, and we had 30 kids on our block, my younger brother and sister. So I started skating around 5, and then probably around the age of 10, 11, hockey kind of starts to get, you kind of can see if a kid's gonna, what a kid's gonna do. And I started to kind of dominate when I was playing, and I was the only girl on boys teams. And so I kind of dreamed of being in the NHL and winning a Stanley Cup with the Edmonton Oilers. And no one told
Oh, is
me,
that right?
no one told me that that wasn't a thing. You couldn't do that. So I had this dream as a little girl, growing up. I was living in a bit of a little bubble out there in Southwest Saskatchewan. So I, 12, 13 years old, I started to go to camps and things like that. And I actually was at a hockey school in British Columbia, and my mom came running in and said, "You'll never believe women's hockey is a full medal sport at the Olympics for 1998." So then I knew I had somewhere to go, and that was where I, dreamed of that I would play in the Olympics at that point. Yeah,
that's when it was announced. 1998 is when they started.
First one. Yeah.
Oh wow. Was it because I think about what youth sports is like right now?
Yeah.
And because we have 2 young girls, 9 and 12, and it's even at like a rec level for things like soccer and basketball, it gets really intense. And so I wanted to ask you about your upbringing, because I imagine, since hockey is like the thing to do,
Mm-hmm.
I imagine like was it like that? Was it very competitive? Was it?
How much driving did your mom have to do?
Oh my gosh, bless you both. My parents, in the middle of nowhere, Saskatchewan, where I grew up, you were driving. Practices, we mostly practiced in town, which was, my dad said, if you're going to practice, you carry your own bag to the rink, because we only lived a couple blocks away. So if it was in the wintertime, I put my bag on the toboggan and pull it. And if it was in the summer, I'd throw my bag over my shoulder and carry it. So, but for games and things like that, they drove literally hours. So it could be like an hour or two just for a game and then back home. So they drove a lot. And that was just how life was. I find now kids in sports, it's an unfortunate thing, because there's early specialization happening in not just hockey, but so many sports where kids go in, and if your kid is deemed good, then it's like time to become an Olympian at the age of 10 years old. And
that's all you're going to do, right?
Yeah. And everyone has a skills coach and camps. But for me, I feel lucky, because I played hockey, and then in the summer, throw my stuff away and play softball, go do swimming, track and field, stuff like that. So I did multi-sport growing up, but I don't think it hurt me at all from my development. And it was a good mental break. So I think kids need that. They need that on and off time and time to play and be a kid. But it's a lot of pressure on the parents now to keep up with everybody else.
Yeah, just the amount of transportation that has to happen is unsustainable.
It's a lot. It's definitely a lot. They're going to need part-time jobs, pay for gas.
Yeah, it's true.
So, long career. You were in 4 different Olympics?
So 6. So 5 winter, 1 summer. So I played softball in Sydney in 2000, and
just got a casual medal in that as well.
Yeah, we did. Right. Unfortunately, we didn't medal, but 5 winter, 4 gold, 1 silver in the winter. Yeah, we should have medaled, but we didn't have a great Olympics. But it was kind of the thing I did: hockey, softball, alternating through the years, and then eventually. When my son was born, I had to decide, and I kept with hockey and gave up softball. It was too hard to do both.
What position did you play in softball?
In softball, I was a pitcher, and I played third base, and a little in the Olympic level, I played third base and outfield, but mostly third base.
That's amazing.
Yeah. And to perform at such a high level
Yeah, sure.
in more than one sport, and then to go into medicine as a career. Like, what can't you do?
Okay. And see, this is another thing. Like, someone, a normal person would be like, oh, a 24-year, history of being in the Olympics and playing professional hockey and all these. Some would call that enough for like a career, but then at some point, and I want you to fill in the gaps here, you decided, oh wait, I'm going to do another thing that's really hard and become a physician. So help us figure out that transition here.
What pathology do you have?
Exactly. I ask myself that daily, like, what the hell did I get myself into? Growing up again in Shaunavon, in my little town, I always
You keep saying little town. How little? How many people?
1,800. So that's little.
That's pretty little.
Very little.
Yeah,
Okay.
that's little for most people.
Yeah.
So my parents were teachers, and I always liked science. A little girl in our community on our street actually was backed over by a grocery delivery van, and she was seriously injured, but I was about 10 years old. So we spent months walking back and forth to the hospital as she was recovering. And it was really inspirational, really impacted my life, the physicians and nurses there, and said, okay, one day I want to be a doctor. So simultaneously, as I was playing hockey, my mom and dad talked a lot about like, what's your life after plan? You should think about, you're not going to make millions of dollars doing this. One day it's going to end. And when you're 21 years old, you're like, it's never ending. But, as I got to the end in my later 30s, it's like, okay, what's the life after plan? So it was always medicine. And while I was playing, I spent as much time in the training room hanging out with our trainers as I did probably in the dressing room through the years, and not because I was always injured, but I was just so interested in what was going on. And I loved the hands-on aspect of medicine. And then in my last couple of years playing with the national team, I started shadowing a friend of mine who's an emergency physician at the Foothills Hospital in Calgary. It's a level 1 trauma center. So what I would do is after games when I couldn't sleep, I would walk across into the emerge and spend 4 or 5 hours there with her. And so I got, in the last probably 3-4 years, I got to see a lot of stuff. And I knew right away that the emerge was my place. And I laughed so hard at your videos, Will, because I said earlier, they got me through medical school, but the emerge skit that you did is like so true. And like it's amazing how you nail all these specialties. But that
I feel like one day you should have it where he comes in with a hockey stick as an homage to Hayley.
I know, yeah.
If you ever see that, you'll know.
Well,
that would be great.
I was gonna say, I wondered if you would relate to some of the rural medicine stuff that I do too, just because of the environment you grew up in.
Amazing. And we send those around in the rural one. I said to all my rural emerge friends, we all laugh at it. So you're bang on with all your stuff, and it's very good. I like the levity in medicine because medicine's serious, but at the same time, people take themselves too serious a lot of times. So it's a nice play on the profession, and it is a serious thing that you do, but you got to have fun with it too.
Well, I definitely appreciate the Canadians because my first conference that I was invited to because of the Glockenflecken stuff was Toronto. Was emergency medicine update? I want to say EM update, which is a thing. And
it's a thing. Anyway. Yeah, I went to it last year. Yeah.
And that was actually my first introduction to what emergency physicians are like when they kind of let loose
as a group.
when they're just out having fun and they know how to have fun. Yeah, that's for sure.
For sure, they do. Yeah, it's a different beast, I think, emergency medicine. But
so it was always so medicine. It was always kind of there. Growing up, you like the science thing. You think, and it was just understood that you weren't. I thought it was interesting that your parents are like, you won't make enough money doing hockey. Like that's not even an option. But honestly, here you are as you've had probably the most success, or as much as success as anybody in hockey. And do you still feel like that was a correct assessment that? Like, well, you kind of do have to do something else. Hockey's not gonna cover it.
Yeah, and I think the thing that happens is in the women's game, like I was the last player on the national team to get a university degree of all my teammates, and many of them had MBAs through the years, just highly educated. They went to Ivy League, NCAA, all these things, because you're preparing for a life after. Because there wasn't really professional women's hockey, and even the professional women's hockey that exists today, no one's making any great money at it. So, you just knew that. Whereas, I work in the NHL now, and, the men think differently because the salaries are much bigger. They don't, I think, tend to prepare for life after as well. But the women do and did. So I had a lot of great role models before me that kind of showed me like, hey, there's a transition that happens here. And although you want to prolong it and deny it for as long as possible, you know that it's inevitable and it happens. So it seemed like and I knew that I knew myself enough to know that if I didn't have something when it ended, I'd be in trouble. And I needed to transition and move into something else quickly because idle time for me wouldn't be a good thing after spending from the age of 15 to, 38 years old in my life in the national team. So it was just, I knew I had to be ready for it when it came.
I imagine you had the easiest personal statement for your for your med
No one
school
can compete with that.
applications.
Yeah.
I mean, talk about just a slam dunk. You shoe in. I mean, my goodness.
I don't even remember. I know I didn't get in on my first try. Actually, I didn't get in on my first try. And so I tell people all the time, just keep trying. And, I remember my interview, I had major foot surgery 5 days prior to my interview for med school the second time. And I had a cast up to below my knee on. I was like on opioids. I was like out of it when I went in there. And then halfway through, I started crying when he asked me why I wanted to go into medicine. But the funny part is that a couple of years later, I was in the lounge at the airport in Calgary, and this man came up to me and he said, do you remember me? And I said, no, I'm sorry, I don't. And he said, oh, I interviewed you at med school. Do you remember? And I went, oh my God, I cried in front of you. And the funny thing is he is an ophthalmologist in Calgary. So there you go. I don't remember his name, but he said, oh, no, that was really good. That was really good. So tip to all the med students, just cry. It works.
Go in on opioids and sob.
Yeah.
Did you ever consider so when the first day you got into med school, was it always going to be emergency medicine the whole way, or did you waver? Did you think?
I knew it was emergency medicine. I knew, yes, I knew it was going to be, I didn't know the route, whether I was going to do 5, 2+1 family. As I got into it, I started to realize that I'm old. I need flexibility. I need to get out as fast as possible. Residency felt like it was taking my life away from me at, like I said, I was 38 years old. So I knew that there, I started to realize, there's different paths to get to where I want to go. And I could be creative with this. And I knew that because I did that as an athlete too, as a girl playing with the boys and then playing men's pro hockey. And I had to navigate this whole world for myself. So I just thought, well, I'm going to go in and take the shortest route to get out, to get my life back. And then I'll navigate it that way. So that's kind of how I ended up doing it. But initially, it was always emerge.
I think some people might have heard you just say, playing men's pro hockey and be like, what, what's going on there? How did that happen? So I think I would love to hear about that. What was that? Was that when you were playing in Europe? Is that?
Yeah. So I went over after the Salt Lake City Olympics in 2002, 2003. I went to Finland. I played 2 seasons in Finland in their first division there. And then I went back to Sweden in 2008 and played over there for a year as well. So it was just ways in between the Olympic years to bridge the gap of trying to play at the highest level that I could. And, it's funny how life works. My son was in grade 4 when we went to Sweden in 2008. And he said to me, Mom, I'm going to live in Sweden someday. And he currently is doing his master's in art history in Stockholm, living in Sweden.
Oh, wow.
Yeah.
That's
so life has
great.
a funny way of, but it was a good experience for me. It was a challenge and I enjoyed it. It was hard.
Was that an accepted thing to happen? A woman playing in the men's league?
Not really. It was it took a lot to just even get a contract. I initially had signed a contract actually to play in Italy, and I was driving to the airport in Calgary I had signed a contract, and I got a phone call saying that the Italian Ice Hockey Federation made a new rule that banned a woman from playing in their first division. So I had to turn around and go back home. So I faced a lot of barriers before I got over there, but Finland they were willing to take a chance. And I remember when I stepped on the ice, the first practice, there was 100 media from around the world around the rink watching because they thought no woman could play. It was a publicity stunt, et cetera, et cetera. And then I took a few strides and they were like, I could hear the collective kind of gasp, like, "Oh, she could skate." So it changed. It changed a lot. But it was. I think a significant part of my career was sort of being the first, knocking down different barriers, and it's just part of what had to be done.
Yeah, aren't you tired? That sounds exhausting.
I find I am at times. I find it in Emerge. I really have to manage although I couldn't imagine doing 20 years of emergency medicine. I don't know how my friends have managed it and done it because it takes a toll, the shift work and stuff like that. But I think when you love what you do, you find a way. But some days I'm tired.
Yeah.
Let's take a quick break. I want to ask you about balancing these two things in your life. So we'll be right back. All right, Hayley. So I want to ask about. So basically, you work as, which one's your part-time job, or which one do you? Is it 50-50 assistant GM for the Leafs, or is it mostly emergency? But is it like half and half? How are you doing this?
I honestly, right now I would say I have two full-time jobs at any given time,
as one does.
Oh, you're one to talk.
Look
please.
At you.
Okay,
you know what
true.
It is.
I do.
Ophthalmologist by day, comedian
Yeah.
by night. No, that's what I do. On any given day, because the ebbs and the flows of the season, and because of the way Emerge works, it enables me to actually be able to do both. So I would say both are full time. At most days, I'm at the rink during the day, and the Emerge by evening, night is how I do it.
At some point, you sleep.
Yeah, that's what I do trying to calculate.
It does sometimes. Sometimes it happens for you.
I do sleep. Yeah, people ask that, but I do sleep. I actually covet sleep. I think it's really important. Sleep and fitness. So I'm a big sleeper. I sleep a lot. Yeah.
But have you ever been? Were you ever like a kind of on the training side? Because I've met a lot of emergency physicians who they work at football games or soccer games, and as there, just in case there needs to be a physician presence. Have you ever done that side of things, or is it always more of the front office?
I would say that I do that right now in a very informal way. So I'm not on the medical staff per se, but many, many days I am. There's no team docs at the rink during practice, so I am the most qualified person in the rink. And we've had instances where a lot of times it's players getting cut. So I have stitched guys up that have been cut in practice or in the summer, standing there in my skates, suturing lips and faces and cheeks and all sorts of things. So that
was going to be my next question. What are the common injuries?
Yeah.
What do you?
You get a lot of lacerations of the lip. You get broken noses. You get shoulders.
Is that
teeth.
from pucks, or is it from sticks, or what's
fists? All of the above.
Hopefully not fists in practice. That would mean they're fighting. So we don't want that. But sticks and pucks. Yeah. The other day I had a player who had a stick right through his lip somehow. There was a hole there. So he finished the practice. I don't know how he did it. Just bit down on his lip until it was over and then had this giant hole. So that was interesting, but often it's pucks and sticks, errant pucks and sticks. Often
How about orbital fractures? You get any of those?
Yeah, we do see those.
That's good. I'm impressed.
That's good.
Yes.
Yeah, we call optho for those.
Those eye injuries.
Yeah.
Yes.
You get eye. We actually, unfortunately, had a player last year. He lost his whole season to an eye injury, and he's back now. So you do get the odd eye, wearing a much longer visor than he had before. So I would say it's a lot of face, shoulder, and then you get groin and hip. So you get a lot of groin and hip labral tears, things like that, soft tissue injuries that come, knees, kind of get everything. But in practice, usually for me, it's the face and the upper that takes a beating.
Why do hockey players not all wear just full length visors?
That's a good question.
That's a good question.
Well, the women do. So people,
because women are smarter.
There you go. That's what I say. I have all my teeth.
Yeah.
Although playing in Finland, like in the second game that I played there, I broke my nose because I was wearing a half visor because it would not go well if wearing a full visor. It would just be like a target on your back. So I put a half visor on and I took a stick right across the bridge of my nose and it did not feel good. So it's very painful when you get hit in the face, like with high flying objects. So I think, I don't know. But now most players wear a visor, whereas in the past, you had the option to wear a visor or no visor, which I think now at modern day hockey, it's crazy with all the facial injuries and how they shoot the puck 95 miles an hour, right? So, so teeth, most of them have little to no teeth left by the end of their career. Yeah.
I feel like it should be a mandate then. If it's a sign of weakness to wear one, well then just mandate everyone wear one. And then you get, rid of that impulse to not wear it because you don't want to have a target on your back.
Well, wasn't there a time when hockey players didn't necessarily even have to wear a helmet?
What?
Yes, there was. Yes. I think that changed in the 90s, 80s.
Yeah.
Yeah.
I remember seeing a photo of a professional player just not wearing a helmet at all, which
I can't imagine that went well.
I mean, just,
I can't even imagine not wearing a helmet now. It's crazy. Even coaches wear helmets sometimes in practice now, just because, as you guys know, one puck to the melon, that's not good. But
how was it? I guess tell us about the end of your playing career. I mean, you probably still play at some point, right? You can't just turn that part of your life off.
Yeah, I'm on the ice with the Leafs probably 4 or 5 days a week because we go out on the ice. And my role in development, it's on ice development as well. So I was just on the ice this morning for a couple of hours actually with the Leafs. So it's the Marlies, the prospects, like our younger guys as well. So it's fun. It gives me my fix. I don't technically really play, but I say I get to pass pucks to the best players in the world. So that kind of solved that.
So there's a big coaching component to what you're doing.
Yeah, I would say your individual skills development, coaching, psychologist, physician, many things on any given day. Yeah.
Well, on the medicine side, are you interacting with like med students, residents? Are you in a teaching environment there?
I do not right now, just because I find I can't manage that. I've got a hard enough time managing myself.
Yeah.
That's to say, maybe that's just one thing too many.
Yeah, I'm not there yet. I also feel like I need a few more years in practice to, I think I'm pretty fresh. So I know where my limitations are and still have a lot to learn that way. So, but certainly, in the hockey side, you do a lot of mentoring, spend a lot of time with, I have 10 staff that work with me every day that you kind of keep in line, and then the players. And as the season goes, you go from, the on ice technical stuff more into, you spend a lot of time just talking about the psychology of managing stress and pressure and getting through your days and performing. So I find it kind of is very soft skills of medicine that I use every day.
Mm-hmm. And you're also involved in like mentoring young women in hockey, right?
Yes. So I have a hockey festival.
Wickfest.
Yeah. She's got a whole festival named after her.
That's awesome.
We need a Glockfest.
You do.
We all just sit around and crack jokes and write skits together. Yes.
That would be amazing.
We've got costumes everywhere. You just dress up in whatever specialty you want.
That would be good. Bring some levity. Yeah, I work with, it's a hockey festival for young girls, 5 to 18 years old. We do it in Vancouver, in Calgary, and Toronto. Next year, we're starting one in Las Vegas. But we've worked with 40,000 kids since 2010, and then they get on ice hockey tournament, and then off ice we do like professional development stuff. So whether it's nutrition, self-esteem, fitness, all that kind of stuff, they get to sign up for sessions off the ice. So that's sort of to my point earlier about developing the whole athlete. I really, really believe in that, kids should not just play a sport, but should get a lot of things out of sport too. So that's where WICFest came from.
Yeah.
That's awesome.
That's awesome. Yeah.
So I have a little activity for us to play.
Okay.
So this is, I don't have a name for this. I guess you could call it a game. By the numbers. We'll call it by the numbers. So I've compiled a list of stats. So basically these are numbers, measurements, a variety of different things. And they have to do with either hockey or medicine or both. All right. So I'm just going to give you a stat and you try to tell me, does this, what is the context for this number? Okay.
Okay.
All right. We'll start off with an easy one. All right. How about 40 weeks?
40 weeks?
40 weeks.
Pregnancy?
Pregnancy.
There you go.
Right.
Yeah.
Exactly. That's how this
for
works.
medicine,
Okay. So
yeah.
40
Okay.
weeks. That was pregnancy. All right. Here's one. 108.8 miles per hour.
That's
Ooh,
I think that was the hardest slap shot in the All-Star competition.
That's right.
That's right.
Do you remember who it was?
I'm trying to think. It's escaping me now. It wasn't. No, I don't know.
Name starts with a Z.
Was it?
It
wasn't Zdeno Chara, was it?
Yes.
Yeah.
Oh, he still holds a record? Yeah.
Uh-huh. That's
Well,
right.
according to
also-
this paper, he does.
According to my
Extensive research.
limited amount of research that I did on this.
Yeah, 108 miles an hour right in the face. See? That hurt.
Oh, ow.
That would be impossible. Okay.
Yikes.
Yeah.
Nice. You're 2 for 2 so far. All right, here we go. 100 milliseconds.
100 milliseconds. Is this some eye thing?
Man, you're so good. It's actually a both thing. One is the blink, how long it takes to blink. Yes. The other one is the typical reaction time of elite goalies.
I was going to say yes. Reaction
I guess
time.
someone did that study to look
Yeah.
at how quickly, which is
That's
incredible.
incredibly fast. Yeah.
That's
A
amazing.
blink.
I think the study's called the quiet eye, isn't it? Is there something out there about the quiet eye? The quieter your eyes are the window to the brain, as you know. And so the quieter your eyes, the quicker you'll be.
Hmm.
I like that.
Yeah.
Of
You got to
course,
start using that.
I'm a sucker for anything eye related, obviously. So, okay, let's see. How about 20 minutes?
It's a period length.
Period length in hockey.
Not a period length in medicine.
I was
Very
going
true.
another place with that. But
Very true. Okay, this might be kind of tough. 2.8 inches.
Oh, man. 2.8 inches. Is that the height of a puck? No, it can't be. I'm trying to think of something outside the box.
Close. It is a measurement of something in hockey.
I'm glad you clarified.
I'll tell you, it's the average thickness of a hockey stick blade. Like
No, can't be.
no? Okay.
Oh,
well,
the width of the blade.
yeah,
Maybe.
yeah,
Yeah,
the width.
the width. Okay. All right.
There
Okay.
you go. All right.
Moving on.
Moving
Now,
on.
here's one.
from
Okay. All right. How about
2.8 inches.
okay? The number is 7.
7.
7. Just 7.
Critical pH.
That's a good one. That
yeah.
works.
Yeah.
That works.
Wasn't on
works?
here, but that is
Okay.
true.
Critical pH.
I've got a hockey version too.
7.
Something that very much has to do with you.
Yes.
World Championships. Is that where you're getting to?
Close. The number of Olympic medals won by the Canadian women's team.
Is that right?
Oh.
First of all, did we get that wrong? Is
by
that
the
why she
team,
couldn't
that
think of
might
it?
be correct.
As a
I
team.
think you're correct.
I think I
you're
have
correct.
5 golds, 2 silvers. Is that right? Does that sound
I
right?
think you're right. Yeah, that's right.
Of which you won 4 of those 5
4
and
plus
1 of
1.
the silvers, right? Awesome. What do you do with them, by the way? Where are they?
Yeah.
They are in a hockey sock in my drawer. And half of them are here and half of them are in Calgary. I don't even know where they are half the time, honestly.
My goodness.
They are like just wrapped up. You wouldn't believe what people do with them. They're not like hung with pride for most athletes.
No.
They're just thrown in a bag. Yeah, like
Oh, wow.
yeah.
Is
I
that
would
like a
not guess
hockey
that.
thing? Is that like a hockey thing or just like the personality of a professional athlete? I don't know.
It's a lot of my friends that are Olympians. It's just, I asked them and it's the same thing. It's like, well, I'm always taking it somewhere. I might need it to get out of a speeding ticket. So I keep it in my glove box.
Keep it in the glove box.
Yeah.
Oh, wait, yeah, let me find my registration. Oh, look at that.
Oh,
It's a gold.
I didn't know that
it's an
was in
Olympic
there.
gold medal. Oh my gosh. I can't
That's so
believe I left
embarrassing.
that there. That's
I have done
Wow.
that. I have done that once.
how else maybe I should be asking you that question. How else have you used
yes.
your Olympic medals for personal?
Mostly it's to get out of things or to get into things. So, you know,
Yeah.
depending on what you're doing, but they come in handy, but they are heavy. They're like 2 pounds of metal and they're big and clunky and they're just kind of a pain to drag around. And then you worry about, I can't leave them anywhere. And so, yeah.
I've got one more number for you. 379.
379.
Yeah.
I would be impressed if you.
Is this osmolality or some weird thing?
You're in the medical. I'm thinking hockey here.
You're thinking hockey. Is this my total points or something?
Yeah.
Yeah.
That's your
Okay.
number of points.
There we go. Yeah.
Number of points in 276 games with Team Canada.
There you go.
168 goals, 211 assists. What's harder, assists or goals?
I always thought
What
scoring
are you more proud of? What are you more proud of?
I always felt like I was a playmaker. So,
Yeah.
you know, making a nice play. I always got more satisfaction out of making a play than scoring. I think that was just my natural inclination, but
Nice.
maybe scoring is the hardest thing to do.
Well, with a goalie reaction time
Yeah,
of
of
100
the blink of an
milliseconds,
eye.
my God.
Yeah. Really.
And they're
blame you.
all 6'8" right now. So they're huge. It's very
Oh,
hard
wow.
to see any net.
Oh my God, yeah.
Jeez.
Yeah, they're
That's-
big. Not like
bigger than
small
they're
you.
getting
goalies.
bigger. Is that? It sounds like they're
They're getting
enlarging.
bigger. They are. Over every year, the goalies get bigger
Wow.
and bigger. It's amazing.
Okay, they're gonna have to make the goals bigger.
Yeah, I think so.
Maybe one day. All right, let's take a break. All right, we're back. Hayley, one more important question we want to ask you about. Were you ever, as a kid, bribed into participating in sports and like trying really hard? Because we're currently trying to figure out how to do this with our youngest daughter.
Yeah, like she wants to sign up. We sign her up, and then she gets to the games, and she's like, completely forgets how to run. Apparently,
So here's what I decided to do, and you tell me, because you work with a lot of young athletes, and so you tell me if this is way not a good idea. I gave her, so I told her that for every basket you get $1. For every rebound you get 50 cents.
mm-hmm.
For every steal you get $1, and for every assist you get $1.
I think I had to point out the assist, though, right? Like you were very focused on like goal,
the
right?
reason
And then
is
I was like,
because-
hey, we should pay her for assists.
Well, that's a good idea, but the reason is because at 9 years old, like no one passes.
Yeah.
They just like,
They don't know what to do.
I think they're so focused on just being able to dribble,
Yes.
and
Or
that-
shoot.
or
Those are your
shoot,
options.
that they don't think about how to. But actually, she's actually a very good passer. But so, what are your thoughts on our payment scale?
Well, I think it could be very lucrative if she decides she really wants to dig in.
I'm already
like it.
$12 in the hole after
Yeah.
like three games. So
That's good. No, my parents did never had to bribe me for sport, but they did say if you don't watch TV for 1 year, we'll give you $500. And I didn't.
Wow.
So the bribing thing can work. You know, it was
it
like
can. Yeah.
yeah. I mean,
I know what's going. You just
That's-
gave him an idea.
that's an interesting one right
get
there.
off your screens. Do it.
Oh man.
We'll see.
Okay. Man, she's
Different
really
world now, though.
Yeah,
Different world.
Yeah.
exactly. Okay, so and I know that we're not the only ones doing this too, because I overheard another a dad talking with
Uh-huh.
his with another kid on the team. It's like, oh, you get about how much money that the
Yeah.
kid made during this. So
Yeah.
I'm not the only one out there. But
Well, we're
definitely
going to
you're
get
not.
all sorts of hate comments on
so,
this one, but
no,
that's
it's
okay.
fine. It's fine. Whatever.
Whatever.
We're desperate.
I have a professional athlete in my house. That's just
Oh yeah, sounds like
not,
Yeah, really. You have to pay them to actually do it.
That's why she's a professional athlete,
Oh, she gets paid.
because she gets paid to
do
That's
it.
right.
to play sports.
You never know.
All right. So, and the last thing I want to chat with you about is a very uplifting topic, which is just the healthcare system.
Mm.
Ooh.
So, I know for myself going through medical school and residency, it really wasn't until I got into practice that I realized a lot of the ins and outs of the U.S. healthcare system. We got our own problems over here, and so what's the temperature on the Canadian side of things from a practicing physician standpoint? How are people feeling? How are people doing?
I think we're probably facing very similar challenges to you guys. Probably much less likely to get sued.
Yes,
but
that's yep.
However, so the thing I always say is like I'm pretty fresh out. I'm a year and a
Mhm.
half out, so I don't have any reference point for what it was like before the pandemic. I came through in the pandemic, and so when people talk, I'm like, you actually got a break. You actually got to go go to the
Mhm.
washroom. You could actually look up for 5 seconds. So I think people are completely overwhelmed. I think burnout is a real thing. I think it's there's a lot of like moral injury inside medicine right now. And I feel for patients. I think patients coming in, where I work, it can be an hour wait, it can be 9 hours wait, depending on the day. And, you do the best you can. The system to me as a rookie and really feels really inefficient and cumbersome. Like there's a lot of wasted time and paperwork and things that we could direct our resources to. So I think, the system is broken, but the people in it don't have to be, is the one thing I would say. And I think that there's a lot of things that we can do as practitioners to protect yourself from it. I mean, if you go to work every day and you just complain about how bad things are, then it's going to be bad. But if you go in there and you find ways to find the silver lining and the levity in things, have fun with the people you work with, try to bring others up, then I think the day is just better. So I try to choose the optimism side of things. I do know that I get tired, I get crusty at different points in my shift in my working month or week. So that's when I have to come up for air and do the things that bring me joy and really stick to those things. So I think being an athlete for me first has really helped me covet, like I talk about health and exercise and wellness, because I do think that that's a real important thing to have, is something for yourself while you're in this crazy, intense world. So I feel for patients, and I feel for the people inside the system right now. And we've got to do something to look at medicine differently moving forward. I just don't know that it's sustainable the way it is right now.
Yeah. I think a lot of overlap there with what we're experiencing here. Just keep showing my videos to everyone.
Oh my God, I do.
That's probably that's like half of it right there.
He's so
the
humble,
solution.
isn't he?
I have to tell you, my sister, and I just talked to her before I came on here. She wouldn't mind me saying this, but she may have to have optic nerve fenestration done. And I'm like, oh my gosh, I'm going to ask Will what he thinks about this. I know nothing about it.
Fenestration. I know the other parts.
So optic nerve fenestration is where you make an incision in the optic nerve sheath in the orbit. And it's done as a pretty advanced treatment option for people that have pretty severe papilledema, so increased pressure. Usually it's either around the brain or even sometimes in the orbit. And so you have to relieve the pressure on the optic nerve somehow.
Okay.
No, it must be, it's got to be with regard to increased cerebrospinal, increased pressure from the CSF. And so, because you have CSF that's surrounding the optic nerve as well. So you make a little incision in the optic nerve sheath that's supposed to help save your vision.
Yeah.
So it must be like intracranial hypertension type
Yeah, it's a
situation.
structural
Yeah.
thing that they're trying to think of how to relieve it. So I said, I'll
Yeah,
ask the
that's
experts.
yeah, that's a very advanced. You got some good ophthalmologists though up there. So I don't know where she is, but
She's in Calgary, actually. Yeah.
yeah. So great docs up there can do. I've seen that done a few times. It's a harrowing experience for all involved. But
Oh, great.
but
Yeah, maybe don't tell her that part.
but
Does she have to be awake?
well, it was. I mean,
I would
no,
assume.
no.
Okay, good.
But I mean, harrowing for me watching it.
Okay.
The docs who were doing it seemed like it was, like just another day. They were
Yeah.
doing one of these things. So I've
Yeah.
never done one. That's above my training level. You have to do some extra stuff to be able to do stuff like that. So, but I wish her
Yeah.
the best.
Yeah.
hope that
Well,
all
the
goes
YouTube videos look harrowing, so that's about all I can
Yeah,
help
I mean
her
it's
with.
Yeah.
and the machinery they use for that, it's this massive. At least whenever I saw the last one I saw, which was like a decade ago, was this massive microscope, like
Wow.
much more advanced than
Yeah.
what we typically use for our like cataract surgeries and stuff. So they got some pretty specialized equipment to do stuff like that.
Very
So,
cool.
yeah. Well, I want to make sure that we mention all the things that you're involved in. We talked about WickFest, which is awesome. I mean, you're just making such a huge difference for so many um, young people coming up playing hockey, but also just people in medicine and showing that, you can have this other thing in your life can be very rewarding, and doing something outside of medicine as well. So I love that. You also have a book?
I do. Yeah. Yeah. It's, I wrote it a couple of years ago now. It's called Over the Boards, but it's essentially a lot of what we talked about today of, how I break down managing stress, pressure, things like that, and life inside the Olympics.
And there's a
Very
documentary? Is that right?
They did do it. Yeah. There's a doc on Crave called Wick. It's just essentially a story of my career. And
that's so cool.
Yeah.
She just plays that off.
Just no big deal.
Yeah,
it's just a little documentary about my life.
I don't know if it's that interesting, but there it is. It's on there. If anybody wants to see it.
I will lavish praise upon you because it is very interesting. The list of accomplishments, the thing I was going to ask you, like, of all the things that you've received from awards and notoriety and everything, what is like the thing that you're going to be remembering? Like what's one of your greatest memories, your greatest moments?
It sounds like you will not be clutching your Olympic medals on your deathbed. So what will it be?
I think winning, like of all the Olympics, probably winning in Vancouver in 2010, just being able to win in your home country and just under the kind of pressure that it felt like we were under as Canadian athletes. So that's something I'll cherish for a long time. Cool. Inside medicine, actually, I think it was the first baby that I delivered as a resident. I walked in the room and the couple recognized me kind of right away. And the Leafs game was playing over my head on the TV. And so I was delivering this baby as the father is watching the overtime. The baby literally comes out and he shouts like, "The Leafs won in overtime." Didn't even pay attention to his child being born.
Oh, no.
And it took all of me not to like fumble and drop this baby. So all I was thinking the whole time is just don't drop the baby, baby, and then get out of there as fast as possible. So, so I'll cherish that I survived residency and got through medicine forever. It was a grind. Yeah.
Yeah.
What was the gold medal? What was the score? The gold medal match?
Oh,
in Vancouver?
3-1, I think. 3-1.
Nice. Who did you beat?
Yeah. You guys.
Did you already know that?
No, I suspected, but I didn't know for sure. I didn't know if it could have been, Russia or one of the other.
Well, it was Sweden in 2006 in the final, and then the Americans in 2010. But you guys are pretty good. You're still pretty good.
You're all right.
Decent.
Yeah,
little brother.
I won't sit here and pretend I've been like a major, U.S. hockey fan. So
yeah.
Dang it. Maybe next time. I don't know.
We just want to keep the rivalry. We just want to keep the rivalry Canada and the US. We don't want to become the 51st state. So you guys can.
Yeah, that's right. Just leave it at hockey.
Yeah, that's right. That's right. We may be taking Greenland, but I don't know.
God.
We'll see. Anything else? Do you have any last minute anything?
I know you can appreciate the sports and the medicine side of things obviously a little better than I can, but I just appreciate the mentorship and the role model that you are for young girls, especially as a mom of 2 daughters. I just love seeing that there are women that the next generation can look up to, and that, when the women are giving back and doing things for that generation, it's like the cherry on top. So good for you for doing all of that. I hope it continues to go well.
Yeah,
just thanks, Kristen. Yeah, thanks.
By the numbers, we'll get through WICFest, over 40,000 young girls.
Yeah, it's just amazing.
And that's across Vancouver, Calgary, Toronto, and Vegas. Is that right?
Yeah, we're gonna do one in Vegas. So heading into the US first time next year. So why not
awesome.
Vegas? You got to go there first, right?
Classic winter sports area. It's great.
It's because we know all the parents want to go to Vegas.
Yeah.
That makes a lot of sense.
Yeah.
Well, Hayley, thank you. It's been a pleasure talking with you. Thank you so much for coming on.
No, thanks for having me, you guys. It was a lot of fun.
Now, that conversation made me want to go get on the ice.
I would love. Okay, I want to see it. Let's go find an ice rink.
I say that as I'm heating my lower back.
Yeah.
with the heating pad. I'm ready to get out and get back on the ice.
I'm just thinking of when you tried to ski, and I would imagine it'd be about the same.
I think I could hold my own ice skate. I know how to ice skate.
Do you?
I can roller skate. I can ice skate. Yeah.
They're not the same.
I know they're not the same, but it's a lot of the same kind of movements.
Nope.
Yes.
I
absolutely.
mean, okay.
You do this. You do the thing.
All right, let's go. I would like to see this.
Yeah, you're talking like I've never ice skated before.
Have you?
Absolutely.
Okay.
Yeah.
So you know whether or not you can ice skate already. Okay. All right. But can you do any fun stuff, or just like you can get around in a circle?
I can do like a double axle. That's all I can do. That's the only thing, though. I mean, I'm not real good at it anymore. I probably lost a step.
Mm-hmm.
But so anyway, used to be better.
Sure.
Could have gone pro.
Mm-hmm.
All right. Tell us what you think of the episode, you guys. I thought it was really fun talking with her.
Yeah, she was great. She's lived such an interesting life, and she's so nice. And I mean,
5-time Olympian.
She's Canadian. Every Canadian I've ever met so far has been really nice. But that's probably a stereotype. Do you think they get offended by that?
No.
Okay.
Because they're too nice to get offended. I don't know. But it was like literally like hockey royalty we were just talking to. You
100%.
You realize that, right?
I do.
Yeah.
I know who she is. I did my research.
Big deal.
Yeah.
Big deal.
Really big deal.
All right. Lots of ways you can reach out to us. Hit us up. You can email us, knockknockhi@human-content.com. Visit us on our social media platforms. Hang out with us in the Human Content Podcast family on Instagram and TikTok. For now, until TikTok goes away. At Human Content
if you're listening
Pods.
to this, it may or may not be on TikTok.
Thanks to all the great listeners leaving feedback and reviews. We love to see those reviews. You can subscribe and comment on your favorite podcasting app or on our YouTube channel at Glockenfleckens. We can give you a shout out like at AliSeuss1555 on YouTube said, "Sorry, not sorry for laughing at your plight with your farting dog."
Yeah.
We've got a very, very
oh, he's so smelly
dog. In VetMed, this is just one of the many pungent odors we deal with on a daily basis. I
bet.
Can't even imagine.
Yeah.
Full video episodes are up every week on our YouTube channel at Glockenfleckens. We also have a Patreon. Lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of the Knock Knock High community. We're going ice skating later. I'm going to show everybody what I got. Early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glockenflecken or go to Glockenflecken.com. Speaking of Patreon community perks, new member shout out, Jack S., Lisa A., Vicky F. Thank you all for being patrons and for joining our little community. Shout out to the Jonathans as usual, Patrick the CSC, Sharon S., Edward K., Stephen G., Marion W., Mr. Granddaddy, Caitlin C., Brianna L., Barry H., K.L., Keith G., Jeremiah H., Parker, Muhammad L., David H. ×2, Kaylee A., Gabe, Gary M., Eric B., Marlene S., Scott M., Kelsey M., Joseph S., Dr. Hoover, and bubbly salt. We don't even need you anymore, Pink Macho.
Oh,
I'm just
don't
kidding.
say
If you
that.
come back- if you
we
come
miss
back-
Pink Macho.
If you come back, we'll be happy. But just a
he's
little,
just a scorned.
just a little bitter still.
Yes.
That's okay. Patreon will at time random shout out to somebody on the emergency medicine tier. Lee S., thank you for being a patron, and thank you all for listening. We're your hosts, Will Kristen Flannery, also known as the Galactic. Special thanks to our guest today, Dr. Hayley Wickenheiser. Our executive producers are Will Flannery, Kristen Flannery, Aaron Courtney, Rob Golden, and Shanti Brook. Editor and engineers Jason Portizzo. Our music is by Omer Binsby. To learn about our Knock Knock High's program, disclaimer ethics policy, submission verification and licensing terms, and HIPAA release terms, go to glockandflecken.com. Go there right now. You can read all about it. Reach out to us at knockknockhigh at human-content.com with any questions, concerns, or any fun medical puns you have. Knock Knock High is a human content production.
Knock, knock, goodbye.
Hey, Kristen, how's the eye contact with your doctor?
Like when I go in for a visit,
Mhm.
we're having a conversation. It's hit or miss. You know, sometimes they look at you, but a lot of the time they're looking at their computer because they have to write down all the things.
You're a big eye contact person.
I am. It's a pet peeve if you're not making eye contact when someone is talking.
You've told me several times.
Many, many times.
You know what would help, though?
What?
DAX Copilot from Microsoft.
That would help.
It makes a big difference.
Yeah, you're right.
Reduces administrative burden, lets physicians focus on patients, make that eye contact,
Yes.
form a connection,
That's right.
not having to look at the computer all the time.
Right.
90% of patients say their physician spends less time at a computer when they're using DAX Copilot.
That's what I want.
It's a big deal. 85% of patients say their physician is more focused with DAX
Ooh.
Copilot. You like focus.
Sure. Who
Focus
doesn't?
on you, focus on the patient.
Focus
Great
on the
stuff.
problem.
That's right. Learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine. Visit aka.ms/knock-knock-high. That's aka.ms/knock-knock-high. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.